I now give the floor to Mr. Mark Lowcock. Mark, you have the floor.
Thank you, Mr. President. I'll focus my briefing today on two areas. First, the impact of COVID-19 in Syria and the preparedness and response measures underway. Second, the humanitarian response across Syria and the findings of the Secretary-General's review of cross-line and cross-border operations, which you received last week. Let me start with the latest update on COVID-19 cases. Syrian government authorities have confirmed 58 cases in Syria to date, including 3 fatalities. Another 6 cases have been recorded in the northeast, including 1 fatality. No cases have been confirmed in the northwest. Building up the limited laboratory and case investigation capacities remains a major priority, and the United Nations is reinforcing this effort across Syria. This includes considerable support from the World Health Organization to the progressive expansion of testing capacities in Damascus, Aleppo, Latakia, and Homs, from conducting repairs to providing essential equipment, reagents, and on-site training of laboratory technicians. Testing capacity is not yet sufficiently established for epidemiological evidence across the country, including in the northeast, where further efforts are underway with support from national and international partners. The United Nations, including the World Health Organization, stand ready to further support expansion of testing capacities across Syria, in accordance with the epidemiological situation and needs. Support is also underway for infection prevention and control, from risk communication and community engagement to isolation centres. Some $23 million has already been allocated from the Syria Humanitarian Fund, which my office runs, to support COVID-19 preventative measures. Thank you to the donors whose contributions have paid for that. But there remain significant shortages of personal protective equipment and other medical items across the country. Let me echo what Geir Pedersen said to you yesterday, further to the Secretary-General's global call for the waiver of sanctions that can undermine the capacity of countries to ensure access to food, essential health supplies, and medical support to respond to the pandemic. Like Geir, I note the public assurances by relevant states that their sanctions programs relating to Syria neither ban the flow of humanitarian supplies nor target medicine and medical devices. I welcome their commitments to fully and expeditiously apply humanitarian exemptions. I continue, like Geir, to follow this issue closely. As in many other countries, we're seeing the economic impact of the pandemic before we see infections peak. After an initial jump at the end of March, the average price of the National Reference Food Basket for April is 15% higher than the March average, and more than double the average recorded in April 2019. It's now higher than at any time since the crisis began. In the northwest, which relies heavily on imported goods, the Syrian pound continues to lose value against the US dollar. Local sources report that as of this morning, the exchange rate in some parts of Idlib has fallen as low as 1,950 Syrian pounds to the US dollar. That's a depreciation of 54% since the end of April. The cost of the dollar has more than trebled in the last 12 months. The rate was 570 Syrian pounds to the dollar in May 2019. The consequences of this for local communities' purchasing power are severe. In early 2020, before the economic impacts of COVID-19 were felt in Syria, an estimated 80% of people already lived below the poverty line. The added impact of the pandemic is now driving food insecurity to record levels. The World Food Programme announced last week that an estimated 9.3 million people in Syria are now food insecure, up from an estimated 7.9 million people 6 months ago. The High Commissioner for Human Rights, Michelle Bachelet, warned this month that killings of civilians across Syria are increasing, and various parties to the conflict, including ISIL, appear to view the COVID-19 pandemic as an opportunity to regroup and inflict violence on the population. Mr. President, I now turn to humanitarian operations in the northwest, where aid deliveries continue at record levels. In April, 1,365 trucks crossed from Turkey into the northwest through the Security Council authorized border crossings at Bab al-Salam and Bab al-Hawa. This is an increase of over 130% on April 2019. There are three main reasons for the scale-up. The first is the rapid deterioration of the humanitarian situation since December, which continues to demand increased levels of assistance. The second is the need to prepare for the impact of COVID-19. As I've said before, the Northwest is considered at extremely high risk of an outbreak. The third pressure stems from the uncertainty we are operating under. The authorization of cross-border assistance under Security Council Resolution 2504 represents the sole channel for the United Nations to deliver life-saving assistance to millions of people in the Northwest we serve. It's up for renewal in less than 2 months. You've received the Secretary-General's review of cross-line and cross-border operations. In paragraph 1, the Secretary-General highlights that he submitted the review ahead of schedule to allow the Council to take a timely decision and avoid the disruption of aid. The findings of the review are clear. Meeting the enormous humanitarian needs in the Northwest requires a renewal of the cross-border authorization for the Bab al-Salam and Bab al-Hawa border crossings for an additional 12 months. The United Nations monitoring mechanism should be extended for the same period. This decision cannot be left to the last minute. Too many lives are at stake. Sustaining pipelines in this massive operation requires weeks and often months of lead time. An environment of uncertainty risks the continuity of aid. It undermines the ability of humanitarian organizations to save lives. In the meantime, our colleagues involved in the operation, from loading staff to the drivers to the UN coordinators and monitors, are at the border every working day, working relentlessly during Ramadan amidst the challenges posed by the pandemic to scale up deliveries. Mr. President, I turn now to the Northeast and the ongoing efforts to increase cross-line deliveries of medical supplies following the removal of Al Yarabiyah as an authorized border crossing. I'm pleased to report that on 10 May, the World Health Organization was able to deliver a 30-ton consignment of medical supplies to Kamishli by road. A second consignment of 23 tons is expected to arrive in the coming days. This is the first overland delivery of WHO supplies to the Northeast in 2 years. WHO is committed to respond to the humanitarian needs of all Syrians in the Northeast by the most direct routes, especially to reach the most vulnerable. While this overland delivery is a very welcome step, let me be clear that much more needs to be done to bridge the gap in medical assistance for the Northeast. At present, medical supplies delivered cross-line to the Northeast are reaching 31% of facilities that previously depended on Al Yarabiyah boarding crossing for these supplies. The findings of the Secretary-General's review of cross-line and cross-border operations are also clear with regard to the Northeast. A combination of more cross-border and cross-line access is required to sustain and preferably increase humanitarian assistance. Several cross-border options were identified in the Secretary-General's report on alternatives to Al Yarabiyah, released in February. This report also described their limitations in comparison to Al Yarabiyah. Mr. President, also in the Northeast, the provision of water from Aluk station was again interrupted and reduced many times since my last briefing, creating severe disruptions in water supply, especially in Hasaka city and IDP camps in the area. At least 500,000 people are affected. To compensate, humanitarian agencies have scaled up emergency water trucking, but this is neither a sufficient nor a sustainable solution. Access to water in all areas is all the more critical in this COVID-19 pandemic. Across Syria, relevant parties do need to ensure the provision of basic services to civilians. So, Mr. President, I've briefed you on the ongoing COVID-19 response across Syria, as well as assistance being channeled through the cross-border operation. Let me also highlight the broader response operation underway from within Syria in areas under the government's control, where the UN and its partner organisations reach most of the people we help. In the first quarter of 2020, the humanitarian operation has delivered food assistance for 3.3 million people, 3.3 million medical procedures, more than 2 million medical treatment courses, life-saving water, sanitation and hygiene assistance for 1.2 million people, education for 1.3 million people, and nutrition support for almost 500,000 people. Mr. President, in closing, I will reiterate my key ask to the Council today. The cross-border operation for northwest Syria, authorised by the Security Council, is a lifeline for millions of civilians whom the United Nations cannot reach by other means. It cannot be substituted. Its authorisation must be renewed. An early decision by the Council will avoid disruption of this vital operation and help humanitarian organisations continue the scale-up that the current needs and the prospect of COVID-19 demand. A delay will increase suffering and will cost lives. Thank you, Mr. President.